recording.
Right.
We only can see who is on the Zoom meeting. We don't know
Right.
who might be watching on
Right.
YouTube.
Right.
Yeah. Not that are the masses, but I'm just saying for us to be aware that there might be other people live on board, like in the meeting, that we are not aware of.
Right. Oh yeah.
Yeah.
Yeah. And people who watch it later, of course.
Right.
Started, Peter.
Okay. Well, welcome everybody. And there are three of us here today from the board of Breathing Science Incorporated, our nonprofit entity. And today is Sponsor Day. That is, one sponsor will be presenting today, and that is the Professional School of Behavioral Health Sciences. And the three of us are intimately connected with the professional school, as well as being on the board of the nonprofit Breathing Science on the Air. And we are on YouTube live right now. And of course, a lot of people will be coming in to watch the recording. And we have a few people logged directly into Zoom at the moment. And so we're going to start up talking about the school and what we're doing and where we're headed and where we've been, just to acquaint people with what we're all very involved in, the three of us. Sandra Reamer here, as everyone already knows, she earned one of her master's degree from the Graduate School of Behavioral Health Sciences, as we were called some years back. Now we're the Professional School of Behavioral Health Sciences. And Wolf actually earned his professional diploma from the school as well. Sandra is a faculty member. She's the director of education for the school. We have a faculty of about 15 people or so. Actually, it's more like 20 now in the school. I'm the president of the school myself, and Wolf is a faculty member on the school and has been connected with us for many years. And so I'm going to start out with just talk a little bit about the history of the school. We actually formed the school back in 2012, and we've been active now for 13 years. We gave the master's degree in applied breathing sciences for a long time. Right now, we're not offering the master's degree. We may do that again soon, but we stopped offering it about, I think, 4 years ago, something like that. And most of our attention has been directed to certification programs that we've created of various types and kinds. And we have different professional certificate programs, and we have professional diploma programs and so on. And we focus these days exclusively on breathing itself and respiration. That is our specialty. That's how we started, and that's where we are now. We have grown considerably. We're a licensed school. We're licensed in the state of Wyoming, where we have been licensed for a long time to offer degrees and professional certificates and continuing education credit, academic credit. We now are working with two universities in Europe, one the University of Malta and one in Italy. And our programs now are accredited by, in essence, by the EU in Europe, and also by the Commonwealth countries. And we're doing this through two different universities, one an Italian university. And by the way, we're also accredited by the Italian Department of Health. I'm not sure exactly how they phrase that, but it is the health division of the federal government has now recognized our program. So we are accredited in the EU countries and in the Commonwealth countries. in addition to being licensed in the United States. Um, and so we have one program I'll tell you a little bit about right now. We have a whole new series of programs. And the one program is called the Certified Capno Learning Breathing Practitioner Program. And we have many different versions of it. One of them is for first responders. We co-sponsor with different entities, and we co-sponsor with an organization in England right now, in the UK, that does our work with the British Navy and with the elite military forces in the UK. And if you were here last or a couple of weeks ago, you would have met Dylan McKay, who we're working very closely with, who actually came through our program, earned his diploma in breathing behavior analysis, as did Wolf. Actually, I think you went through the program together, didn't you, Dylan and
Yes,
yourself? Yeah.
yes, we did.
Yeah, and so we have different versions of this certification program, and one is for first responders with Dylan McKay. We have another one in the area of pregnancy. It's the same program and the same certification program, but it's slanted towards pregnancy. Yet a third one in neuromuscular applications. Then we have our generic program, and then we're doing the same program with a university in Italy, the same program with a university in Malta. We're going to be doing another version of it in athletics coming up here very shortly as well. And so we have many different versions of this program in different settings that we're very excited about. This program is automated, and we actually created it a year ago and have been offering it now for a year in its automated format, where professionals can come in and go through the program at their own rate, and as they can do it. Literally everything is automated. There's a testing system, an automatic testing system that they go through, so that when they finish a module, we have 10 modules in the program. And as they go through a module and they complete a module, they take a test that takes about 10 minutes. It's a multiple choice test. Just to give you an example of how we're organized. And if they pass that exam, they go to the next module, and they have everything available to them for that next module. And as they go through the modules and they pass the test, they come to the end, and then they've completed the academic part of the program. But there are practicums that are done throughout the program along with the modules. And those modules are actually looked after by AI. So we know exactly what they've done, when they've done it. And they essentially then at the very end go through a live interview. It's a 2-hour interview where they present 2 of their cases to our practicum supervisor in the program. The idea of this, by the way, if you don't do well and you flunk a test, what it does is the module resets itself and you listen to it again without knowing the answers that you missed, without knowing the questions that you were unsuccessful at. You don't know that. You have to basically listen to the whole thing all over again, not knowing what it was that you didn't know, which really it really works well, and that people really listen again to the recording thoroughly because they don't know what it was they didn't know, and it works very, very well. It's a very, very successful program that has been put together. We're really excited about it, and looking at all these different versions of it, and the different versions of it. When we get to certain modules, like the applications module and what we call the demonstrations module, for example, in Dylan McKay's case, where he's involved in the first responder program, the high performance program. All the cases are basically about what first responders encounter in their work. All the demonstrations are with first responders and the people they work with, and so on. Everything is tailored to that specific application. So we've really progressed very substantially in what we're able to offer to what people. And we also have, there's a rental program for people who don't have capnometers, and most people coming into the program don't have capnometers, and they can rent the capnometers very expensively. And then at the end of the program, if they want to buy that capnometer, they can. There's a whole new capnometer coming out, I should mention, that we're going to be using in the school, which is basically a headset, like what I'm showing you right here. The capnometer looks exactly like this, and you can put it on and you can wear it. They're inexpensive compared to anything we've had access to in the past. The Better Physiology actually designed this new capnometer, and it's going to be coming out the 1st of June or the end of May. And so you'll be able to, people will be able to go through the certification program and get trained in all this for just a fraction of the price of what it used to be. So that's a very exciting thing. We're trying to make it accessible to people so they can work on their certification and go through the program at their own speed as they have time, and where it doesn't cost an arm and a leg to learn how to do this work. And so we're very excited about that. But we have a lot of other programs as well, but this is what our principal program that we've been working on. And this is very important because we need to train as many people as possible. We really need to get a lot of people trained. We're working with the National Health Service in the UK, for example, who are very involved in bringing the field of capnography into what they're doing. They're talking about providing thousands of patients with this new device, which is very exciting. But the problem is that they need to have people who can work with those patients. They've essentially identified 34% of all the people that they have diagnosed with asthma as having no biomarkers for asthma. That in essence, they don't have asthma. They have the symptoms of asthma, but they don't have the asthma. 34% of all the people in the National Health Service who've been diagnosed, they're now saying these people, what they need is breathing training because it's a carbon dioxide deficit that's bringing on these symptoms. So they're very excited about bringing what we're doing to what they're doing. So that's why we went to work to design a program where people get through it easily, efficiently, at their own rate, at a reasonably low cost, and where they actually have a capnometer that they can acquire at a really low cost as well. That's what we've been doing, and we're very excited about that. Meanwhile, we're still offering other programs. We have a program that we've now offered 5 times by Scott Sonnen, who's someone who earned his master's degree with us. And it's in high performance in the military. Basically, it's all about the U.S. Special Forces and how they implement breathing behavior analysis and what they're doing. They're saying that this is a missing link in their performance training in the military. They're talking also about bringing capnography on a very large scale into the Special Forces because of these different changes that have occurred. And we have to be in a position to work with them and train them as well. But we offer his program, which, like, as an example, it's a 2-day program that we offer. We've offered, this will be the 5th time that we've offered it. And we offer programs like that. If you're interested in that kind of a program, you can go to the Better Physiology, not the Better Physiology, but you can go to the school website, the Professional School of Behavioral Sciences and look up the description of that program. You can register for the program. You can go to bp.edu. That's www.b as in Bravo, P as in Papa. Basically, breathing physiology, if you will. So you can go to that website, bp.edu, and look that up if you're interested. And so there's also a description of our diploma program there and so on. So what I'd like to do is just ask Wolf and Sandra to make some comments about their involvement in the school and what they see in regards to where we've been and where we're headed, and some of the feedback that they could provide that would acquaint you, in a more wide-ranging kind of a way. Why don't we start with Wolf and see what Wolf might have to add?
Okay. Thanks, Peter, for the background on the school. And I just want to bring some awareness to something that is, for me, has always been an interesting question, which is where to go to get proper breathing training, to do, to where to go in order to get the skills and the knowledge it requires to work as a practitioner in any field related with breathing or with the main focus on breathing. And I've been doing so many different things before I met Peter and before I come across the professional school or graduate school of behavioral health sciences. And I know that, that the amount of trainings that are available is kind of, in my perception, exploding. And there, what are the criteria? What should be our standards? What should be our requirements for a good breathing training, right? Because Peter, you were talking a lot about already what the school offers, but I think there is this question lying underneath all that. Why to have, is a university or is a secondary education level the right level for breathing training? And if that is the case, why do we have all those self-declared breathing trainers that have no formal education in maybe any of the fields, or I don't know, is there a gap and I think there is, right? So I just wanted to acknowledge the existence of the schools, because I think at that level where you say, okay, you have a certain standards, you have the standards of a university where you want to have a qualified faculty, where you want to have like in science, you want to make sure that the knowledge and the skills that you teach, that they are sound, that they are established, that they are the golden standard, right? And that's something that really has made the professional school for me very different from many other opportunities and possibilities to learn about breathing. And I'm not saying there are not a lot of interesting modalities and not a lot of interesting ways to learn about breathing out there. That's not at all what I'm saying. I'm just saying that the school is offering something that I think I don't know where to find somewhere else. I don't see it anywhere. I didn't find it anywhere else. So that's I think something that I find interesting, and I think it's interesting to talk because we're talking about breathing science, and we are talking about as a field and how we teach breathing science and who can teach breathing science and based on what knowledge and based on what skills. And that's, I think, a discussion that we should have, right? And that's, I think, a very interesting discussion that I don't want to go too deep into, but I just want to bring it to the table in order to maybe if Sandra or Peter, you want to go there in the discussion. Yeah,
Yeah, I mean,
yeah.
I mean, that's really important. I mean, the reason that we established the school originally was to really appeal to the idea of a breathing science, which really didn't exist. Um, there were all kinds of schools, so to speak, that address breathing as a technique for achieving certain objectives, but and all these diverse groups out there, ranging from yoga and meditation to breath workers to, physiologists to medical people and physiotherapy. I mean, applications coming from all kinds of necks of the woods, let's say, coming from so many different places. But really no place where people could really get any kind of formal training, meaningful formal training in what we call breathing science, where we bring a lot of science together in one place to understand the phenomenon that we call breathing. I mean, there was no place to get any kind of recognized, credible training, and that's what the foundation of the school was this consideration. But we got into a lot of other things too, not just breathing. We got into integrating behavioral science with physiology in other kinds of fields as well. Like, for example, in dentistry, we offered a certification program for a long time, integrating myofunctional applications with breathing and behavioral science and the physiology of respiration and so on. We got very involved in the area of airway medicine. Sandra and I have two chapters in a book coming out now on airway medicine, where they were really interested in the behavioral side of what airway medicine's about. That really came out of what we've been doing in the school for all these years. This whole nonprofit, we're interested in is trying to make breathing science a reality where people from different walks of different professional walks can come together and talk about their interests in breathing and respiration. Again, breathing and respiration being to a great extent two different considerations. They're not the same thing. Although in many languages they are. Breathing and respiration, there's just one word for it, one verb. Whereas in English, there's two verbs. There's breathing and there's respirating, and they're not the same thing at all.
Mm.
And so this is an important thing to understand. You understand this when you understand breathing as behavior. Then you understand breathing as behavior, and you understand respiration as a fundamental reflexive kind of an enterprise, and they come together, the behavioral side, which is the breathing, and the respiration, which is the reflexive side. And so, that's not germane to what we're talking about right now, but it's fundamental to what breathing science is about. But that the foundation of what we were doing was we're trying to bring some formality to this field that we call breathing science. Get people together to have conversations, talk about it, bring traditional physiology together with breath work or whatever breath work is. We don't consider ourselves, by the way, and the work that we're doing right now, in breathing science on the air, we don't consider what we're presenting to you as breath work. What we do is we're trying to bring science and practice together around the subject of breathing, how we breathe every day. We're breathing all the time. Like, I'm moving my arms all the time. I've learned to use my arms in a certain kind of a way. And you don't explain what I'm doing with my arms by making reference to the muscles in my arms. So why is it that Peter is moving his arms around like this? And you try to explain it by making reference to the physiology. That doesn't give you any information as to why or how I'm moving my arms around. And this is what you see in breathing, where people are breathing in a certain way and they try to explain it by making reference to chemistry and muscles, and that's it, without making reference to the psychology of it. You can't understand what I'm doing with my arms if all you do is talk about the muscles. The muscles don't explain why I'm moving my arms like this. It doesn't explain anything. Those are the mechanisms that are necessary. You have to have muscles to be able to do this, but it doesn't explain why I'm moving the muscles the way I am. It's the same thing with breathing. Breathing is a behavior. It's like my posture right now isn't determined. You don't make reference to all the physiology. It's really about how I've learned to hold my head and move my arms. It's the same thing is true of breathing. And people don't understand that. They don't get to that, because to understand breathing, you have to understand the psychology of it. If you don't, there's no way you're ever going to explain what's going on, any more than you can explain how I'm moving my arms without making reference to my learning history and who I am as a person. You'll never understand why I move my arms the way I do. Breathing is behavior. It's just like moving the arms. You learn to breathe in certain ways that affect you in all kinds of ways. And so we see breathing as a part of what we're doing all the time in our lives that changes constantly based on our learning histories, based on the motivation behind the breathing that we're doing, and the consequences of what we do. And so that's where we are, and that's where we're trying to bring together people coming from many, many different fields. We're trying to do it through the school. We're trying to do it actually, and another one of the sponsors of this on the air is Better Physiology. And all the sponsors really pay for on the air. We are the ones who support it. And we have about 10 different sponsors who support this on the air enterprise that we really want to get going on a grand scale with the help of a lot of people who are reaching out to help us out. Now, Sandra, would you have some comments you might make in regards to one of our sponsors, the school, because we're here as a professional
Sure,
school?
sure. I'd be happy to jump in. So, one of the things there's just so much that I appreciate about what this school has to offer when it comes to the integration of behavioral science with respiratory science. So bringing together the biological and the behavioral sciences brought to respiratory science, and really bridging, like Wolf was saying, a gap that we haven't really seen in education today. And of course, since now we have technologies that we haven't had in the past, to be able to bring technology in with learning online, which is now being done by so many institutions, but the opportunity to learn from home, paced within an individual's professional schedule, or an individual who's really interested in learning about breathing and wants to move forward to understand the relevance of what it means to optimize respiration and how that requires aligning breathing mechanics and respiration together, that beautiful blend, so that if that's not being measured, as we've touched on in the past, where you're utilizing relevant technology that can actually measure carbon dioxide, um, if you're not measuring and you're not doing it in real time, then you're missing out on a lot. And this school brings that technology in and integrates it so that the learner from home can be utilizing instrumentation, learning more about their own psychology, why they breathe the way they do, and going through the learning modules and bringing in the science and folding that into their own personality, their own inward experience. And then how can they bring that into their professional work? That's also explored within the learning modules by different practical applications that we offer people. so people can experience that as individuals, where you learn such a tremendous amount that you can then bring into your own practice, and or in your family setting, if you have individuals in your family who could benefit. Because what we've learned from a lot of attendees who've gone through our program is oftentimes the parents who have learned certain breathing behaviors that can be again learned by the children. So it can become like a system, whole family system can be learning challenging breathing behaviors and not realizing it. So with using instrumentation to monitor, get kids young and early learning in the family system about breathing and what they can do, because you as a professional now are bringing it into your life and into your clinical setting, and then into your family setting, where it's very friendly. It's a lot, this beautiful integration of bringing science into learning um, in a very applicable way, where in going through all these modules that you get to experience at your own pace, now you get to bring it into your life and embrace it, just as Peter was saying, where you're moving your hands to express, for example, in a particular way. Breath becomes a dynamic, friendly space to enter into, to learn about your own psychological state shifts, to learn about your own psychology, to bring in the whole field of psychology and that breadth of what the field of psychology has to offer into the biological sciences in a way that's very humanizing, with technology that you can use to personalize it to the way you like to move in the world, within your individual self, your family system, in your community, in your work. So we're really wanting to enliven breathing in a way that we haven't, I haven't seen it done before, that this school is very unique in that way, where we're integrating the science. So we're not saying we're medical. What we're saying is that we're really wanting to bridge where these gaps have been, where we can now bring science to the humanizing experience, uh, rather than, as Wolf was pointing out, there's a lot of gaps where people will focus on certain techniques and approaches, but are they measuring, and what are they measuring? Is it relevant? Um, what's the new science around that? What's measurable? And to be able to measure in real time using instrumentation that is relevant can really be a game changer, so that practitioners and providers are innovators within their own profession in ways that have them stepping out into the fore, and really being leaders, so that education, rather than just book learning, um, test taking, you really getting this humanizing personal experience, and then being able to come together to share, for example, after you've gone through the practical applications in the learning modules. I get to meet with you all and have discussion with you and hear some of your cases that you've experienced and practiced on your own, and we talk about those and ways you can further integrate what you've been learning so that it feels natural and alive for you. And this I find extremely exciting, because this is a living, breathing work in progress that we're always learning. We get to learn from you as attendees, all the attendees that come to the program. It's a very diverse program because people come from all different professions, because everybody's breathing. So we can't just say, oh, it's only for respiratory therapists. We're opening this up to the world, because the world, we're all enlivened by breath. We all understand that this is critical for our lives. So the school gets to help support that bridge, and we're always developing our materials and we're always learning from individuals. So candidates who are interested in integrating breath into their work, their professional work, or as individuals or within their family systems, we encourage you to go to our website and read through our materials. Let's see, we are, well, right now, aren't we bp.edu, or have we
Yeah, no,
changed
it's
our
BP. No, it's
platform?
the same. No, it's the
Yeah,
same.
yeah. I mean, take a look, go online, read about the certificate programs that we offer. We do have the core program if you're not within one of the very specific programs that we offer, for example, high performance in military. If that's not you, no worries, because our core program will really reach out to you. It is the fundament for any of the other programs. And of course, it does get personalized to the individual when you're doing the practical applications and using the instrumentation. You will need a CAPNO trainer, which the Better Physiology will be talking more about that when Better Physiology presents more on that instrumentation. And it's again such a like a breath of fresh air to be able to use an instrument at home in your life, just integrating it, just like you would, when you eat breakfast every morning. You are integrating this as a part of a way of life. So you get this opportunity to really enhance who you are as an individual and what breath means to you within your own orientation, and perhaps even challenging your own orientation, that the world of breath and breathing science is much larger than you may have ever perceived. And to be able to expand into that is very refreshing. So we're very encouraging. We're integrative. We love to bring in all types of folks who are interested, that practice breathing, that have approaches they use. Now they get to monitor and explore how they can open that up for themselves by bringing in the science, by measuring, by sharing with us, one-on-one work, by entering into dialogues with other cohorts. So we would love to have you if you're interested. Please
Yeah,
look us up online and learn more.
we have a,
Yeah.
we have a faculty of, fantastic faculty of psychologists and physicians and all kinds of people in athletics and physical therapy. I mean, we have, people who really know how to do breathing behavior analysis work. That's really what the best description of what we do is breathing behavior analysis. All our programs are directed to that. Now, we do actually have someone who got certified through us who's in the audience here. We have Deborah Durant there. Maybe she'd like to make a comment. She went through the certification program. You have any kind of comment you might want to make, Deborah?
Not to put you on the spot, Deborah.
Right. You can unmute yourself if you'd like.
Can she unmute herself, or I think the host,
The host
There we
has to.
somebody,
go.
yeah, there she
Thank
is.
you.
Yeah.
Yes, hi, and hi to everyone. I graduated in 2023 with the Certified Breathing Behavior Analysis. And what brought me to this is I was doing a breathwork facilitator. So I was literally training people to overbreathe. And in one of my sessions, the person had tetany, the lack of oxygen going into her hands, and she couldn't move her hands. I had no idea what this meant or what was going on. So that took me into a deeper dive. And I ended up with Peter and Sandra in the Professional School of Behavioral Health Sciences. That really opened my eyes, literally changed my life. When I started, my CO2 levels were 18 to 20 millimeters per mercury. And if you take the course, you will understand all of that. I am now able to reach 40 and 45
Oh,
millimeters per
Deborah.
mercury. And when I started this and I was taking the exams after the modules, my concentration was so poor. I would sit there, I would read one sentence and go, oh my God, what did I read? And I would sit and I would get my capnometer on and I would bring up my CO2 and then I would begin studying again and answering the questions and monitoring it. So for cognitive function, it's amazing. I mean, it's amazing for everything, right? Physiology. But that's where I started. And it has changed my life. I am working in the industry. I've worked with people with concussions and pregnancy and chronic fatigue syndrome. I am hoping to take the program uh, with Dylan in July, but we'll see how that goes. I just wanted to share that because these programs are for everyone. Absolutely will change your life. Thanks.
Thank you, Deborah. Thank you
Thanks,
very much.
Deborah.
Thank you.
Yeah, it's great to hear individual experiences, right? People who've gone through the program, because it's in that way, it's not like other programs. You really have the opportunity to take it into your life if if you want to apply this while you're learning. You don't have to wait until you're done through the program. You're learning while you're in the program with yourself, with family members, with others, with volunteers, really enhancing and changing lives. So we're very excited about that. Thank you, Deborah, for sharing that.
Definitely.
Yeah.
So, Wolf, any further comments on your side?
Yeah, it was just for me, it was interesting to listen to you, Sandra and Peter, how in the way you talk about breathing, there is no separation between breathing and science. They are kind of always kind of ultimately merged. They just, you cannot talk about breathing without talking about the science around breathing. And that's so contrary to what I experienced before I started with the professional school, where I just realized that, where
Mm,
science and breathing were just kind of really, they didn't even touch each other. Because breathing was about, introspection. Breathing was about self-perception. Breathing was about individual, whatever kind of experience with whatever kind of technique, over breathing technique, kind of. So, and it seemed that the science, if there was any science, it was kind of more or less like not really, it was immaterial to what the treasure of
mm,
breathing offers, right? So
mm,
it's kind of and I'm realizing how contradictory or how different that is. That we have that out there, and there are so many techniques and schools and modalities that maybe they include some modules in their trainings about physiology, or they include some other whatever kind of science pieces, but it's not integrated, because it's not about having science and having breathing. It's a different thing to have breathing science.
mm,
And the name of the school is Professional School for Behavioral Health Sciences. So you start from the behavioral, the psychological part, and bring it together with the health, the physiological part. So it's this very specific alignment of things, right? Of the psychophysiology. And that's where I wanted to get, because so far in all the podcasts and in all the things we have put online, I always talked about psychophysiology. For me, this is kind of the key term that I always like to frame my thinking around. So, so psychophysiology kind of, and breathing is behavior, obviously, okay, we know a lot about behavior in psychology, right? So why we don't bring that to the table? Nobody does that when it comes to breathing. Peter, you do that because for you, breathing is breathing science, and they cannot be separated. But I think this way of thinking, this way of talking about breathing, is a very unique way. And I think we have to be aware of that. And I think that's why it's so important to create this field. To see, not to separate from, from other people who are interested in breathing, quite the contrary, but to bring the clarity, the intellectual clarity that is just makes us, everyone who does whatever kind of breathing related things in their professions, to be more informed and be more aware of what we're doing.
I love that you're saying that, Wolf, because as you're talking, I'm remembering hearing people in the program like physicians, psychologists, dentists, counselors, all kinds of people saying, well, I didn't get this in school. Why is this? Why am I not getting? I should have gotten this in school. Why didn't I get this? So it's really exciting for people to have that revelation, to have the integration, and everybody gets excited about it. They don't feel like, oh, you know, they don't feel bad because they didn't get they didn't get, they just get lit up because now here's this space where so many walks of life can come together from different professions, and everybody's like saying the same thing. So we know we're reaching people in a way where there's a need, and it is lighting up what they do in the services they provide to people after they get through this program, not only changing their life by bringing what you're saying, Wolf, to the table for themselves and their families, but the lives of so many people in their community and changing professions really, and learning in general. Um, because
Well,
like you're saying, yeah, the whole role of learning is perceived now in a different way. Peter, you're going
most
to jump in?
most people know of Joe Mercola, Dr. Joe Mercola. He's a household word, and he was telling me that what we're doing here in the school, it should be taught in every medical school in the country. It should be a part of the curriculum.
Mm-hmm.
And I was recently talking to a Harvard medical professor who was also telling me the same thing, that it ought to be taught everywhere. And it can be taught on different levels. It can be taught on the personal user kind of a level, as well as the level where a professional may be involved in integrating the work into what they're doing, whether it's medicine, psychology, physiotherapy, whatever it might be. So we have a tremendous amount of support on the part of the traditional healthcare community in regards to what we're doing. It's not something out of left field. It's something that is centerline in healthcare. It's being recognized as being fundamentally important. For example, our invitation into the airway medicine book, that's a major textbook coming out here sometime this year, where they really wanted that contribution in that book. I mean, it really is something that's coming into the forefront of interest in the healthcare professions. And so we're there to try to support that as much as we can with what we're doing in the school.
Mm-hmm. Yeah, and again too, because Mercola and so many other providers and people who have expanded what they provide. So like you were pointing out, Wolf, about um, for example, a breath worker would have a certain way of working. Now they can expand that opportunity. And Deborah touched on that as well, where they can be exploring what they've learned and challenge themselves to open to the immense literature and possibilities that science can bring, as well as the psychology, and really integrate it, like Deborah was pointing out as well, into her own personal experience during the learning process, which is extremely empowering, um, and reconfiguring an orientation with, in a way that's very friendly and supportive. We're not, so many people get worried that, oh my God, I've learned it wrong, or I'm not doing it right, or the old modalities. We're really not in that space. We're in a space of integration, friendliness, expansion, growth, learning. Physiology, as Peter was saying, is always learning. It's learning with and without your personality. Um, and we're very present with that and aware of what it means to learn. We take it very seriously, not necessarily, isolated in an academic way, but in a very, as I was touching on earlier, and as Wolf was saying, the psychophysiological, the science part, the humanizing parts come together. And that's a very exciting space to be.
Well, anybody else have something to say before we
There's so much to say.
I know there is. There is. I mean, how do we even start into this subject? It's
It's
extremely
such a huge
exciting.
subject.
There's so much to this. There's so much you can do to help others if you're in a helping profession. There's so much you can do in regards to your own lives, in terms of both health and performance when it comes to optimizing respiration and then optimizing breathing as well, because breathing and respiration, I say, are two different things. A lot of breathing isn't about respiration;
Mhm.
it's about other things, and so there's so much to talk about, and this is why the school, came into place, where a lot of us came together to try to create something that could be worthwhile to practitioners that could take breathing science and bring it into what they do as professionals. And now, of course, we're trying to go directly to the general public with what we're doing. We're really moved to another level in what we're all up to these days. And I'm not sure how the school is going to be involved in that, because we've been involved in helping professionals bring this work to their clients. Now we're also interested in getting the general public directly. So that's something that we will be addressing ultimately. But my final message is that if you're really interested in breathing and respiration from a professional standpoint, from a practitioner's standpoint, this is a dynamite opportunity to come in and be, participate in our certification programs. I mean, it provides what no other programs provide. We bring together so much, and it's based on so many years of experience, bringing technology and science and the application of those things together in one place. Please take a look. There's so much
Website?
opportunity, so much opportunity. The website, bp.edu,
There you
there,
go.
there, you can really take this a long way in what you're already doing. And if you're looking for something new to do, if you're looking for a new kind of a profession, you have the right background, this is a great place to go. People have made it, you know, they've been really very successful in creating businesses around providing these kinds of services. And we encourage you to really take a look at it. We need you. We need lots of people trained to be able to get it out there in a meaningful way. Without training people, it's only going to go so far. We need you to get involved in this. Please think about it.
Lovely,
Well, I think
lovely.
that's probably it. Thank you very much, everybody, for being here, whoever you are out there. So Thanks. We'll see you again. We'll be on the air 2 weeks from now on another topic. I don't remember right now what the topic is, but you can look it up. And then there'll be another sponsor program sometime in the summer, and we have sponsor.
Is there a
days.
place where the topics are posted?
Oh yes, you go to On the Air, and you can see them all posted there. You can go to the bp.edu website and click On the Air to see these things. And of course, you get a notice being a subscriber. If you are a subscriber, you get notices about this as well. So
Oh, so
anyway,
people can subscribe. Just anybody? Like anybody who's listening today?
most people who are here are subscribers. You have to
Okay.
subscribe to be able to attend. So on YouTube, you can come in, but the idea is to become a subscriber, and there's all kinds of benefits if you become a member or sponsor. There's different kinds of ways to be involved. You can be an affiliate, you can be a sponsor, you can be a member, you can be a subscriber. Being a subscriber is free. Anybody can come and be involved. But there are benefits to being a subscriber for sure. If you're not a subscriber, and then being a member, there are yet other benefits.
And are the benefits posted on the site?
Yes, it's
Great.
all described.
Yeah,
And
super.
the membership requires a donation, which you can make it whatever you want, but it's a minimum of $25 a year to become a member. And so if you're not a member and you are a subscriber, you might think about becoming a member. Or if you are neither, you might want to subscribe. Anyway, thank you very much.
Good. All right. Thank you, everyone.
Thank you.